Well, I'm at the child neuropsychiatric unit in Göteborg, Sweden, and I've been there for 15 years. Before that, I was at a pediatric hospital, and I'm doing research in neuropsychiatric conditions for children like autism, ADHD, things like that. We were interested in alternative treatments for ADHD because of course we've done studies with medications before and treated a lot of kids, but alternatives are needed. So we heard about the studies in England and later in Australia. So then we thought that we would like to test the composition of the substance which had been tested and had positive results. We would like to try that. That's why we chose IQ. Our own study, which we did some years ago, and it was published in 2009. It was a randomized placebo-controlled trial with IQ. And the first study period of 3 months, you got IQ or a placebo, and it was followed by a 3-month open label phase. Here we were careful to diagnose the children with ADHD clinically, and we were careful to select or to define the comorbidities and to have exclusion criteria that they were medication-free, for instance. They would not have serious medical conditions, and they were also in the normal range of IQ. And some of the measures, or the main measures, were the ADHD rating scales and the CGI scale, that's a clinical global impression. We assembled 75 boys and girls, mostly boys, which is common in these studies. As I said, we were careful to define the comorbidities, and as you can see, and as many other studies have shown, when you have ADHD, it's almost certain that you have something else. Some 70 or 80% of children with ADHD have something else, and that could be DCD, which is developmental coordination disorder, that is motor difficulties, motor coordination difficulties. It's not uncommon with autism spectrum symptoms. Reading and writing disorder is common, learning difficulties, and especially maybe oppositional defiant disorder. To find what was clinically important, we didn't just use the statistically significant results. We used the definition of responders, and a responder is one who has good effects. The usual responder definition in medication trials is 25 to 40% improvement, something like that. Something that would be noteworthy in everyday life. And you can see in the first double-blind period, study period 1, there was 26% of the active group who were responders, as opposed to 7% of the that were non-responders. And that's a statistically significant difference. And when we went on to the open phase, after 6 months, it was 47% of all who were responders. That's the main results of the study. And when we look at the subgroups here, after 3 months, you could see that the AD, and we mean AD means the ADD type of ADHD, ADD subtype. They had a somewhat better response than the ADHD in general. And those who had a reading-writing disorder seemed to have a better response. The responders were more frequent there. After 6 months, you could also see the same thing, that the AD group had more responders, and the reading-writing disorder group. And in this study, we took also blood samples at the baseline, after 3 months, and after 6 months. And we measured several things, but I'm just going to look at the omega-3, omega-6, and the omega-6, omega-3 ratio. And you can see from the 75 children, there were 54 who we could get a blood sample from. Not everyone managed that. And we wanted to know if there was any difference from the start, and we can see that the baseline omega-3 and omega-6-3 ratio was no different between the active and placebo group. And we could see after the change in omega-3 levels and omega-6-3 ratio, we could see after the double-blind phase was statistically different, so much better in the active group than in the placebo group. So that was very clear. And that also told us that they really had taken the omega-3/6 capsules, that they had some sort of compliance at least. And then we looked at the responder and non-responder groups. And then we found a statistically different result for the omega-3 and the omega-6, omega-3 ratio. That was clearly better. The change was bigger for the omega-3 measure and the omega-6, omega-3 ratio. So those two measures seem to be the most important. And after 6 months, we could see that the omega-6, omega-3 ratio was still significantly larger change than in the responder group than in the non-responder group. So the omega-6, omega-3 ratio seems to be an important measure, and that seems to be what we can change the most, or what is most important. Well, I met a few patients, or quite a few patients, that really had good effect with IQ. And this was, they really changed their lives, and not only could they concentrate better, but they could read better. And I mean, they were 50% better than compared to before, so that was a real big difference. And those cases were the best experience, I think. Mm-hmm. So it seemed to be very effective for some children. And we found indications that the subgroup with ADD, or not as hyperactive ADHD, had better results. And those with reading and writing difficulties. Well, it seems that the ratio matters because there are quite a lot of studies done now, and the ratio between EPA and DHA in the fatty acids seem to be important, because the studies focusing on DHA have not been positive. But our study and the English and the Australian and other studies with IQ, which is dominated by EPA, have been more positive. The best study results have been for the supplements who have a higher EPA content, so I would advise them to use that kind of supplement, and I always advise them to use the supplement that has been the most researched. We think that the subgroups with ADD, or the more quiet attention deficit disorders, and the reading and writing difficulties may benefit the most. We found stronger effects in kids with neurodevelopmental disorder, and I mean that's ADHD, motor difficulties, reading and writing difficulties, sort of a complex of neurodevelopmental disorder. There are some positive indications that mainstream kids may benefit from omega-3 in their learning and their reading and writing, but there are not so many studies there. The same thing there in mainstream kids, the DHA doesn't seem to work. It seems to be the EPA that is more important. We've just finished a project which will be published in the next year, I hope, and that's on mainstream children with reading and writing ability. And then we would like to do studies in children with attention deficit disorder and reading difficulties, as I said, the subgroup we think benefits the most.